Honorable members of the Health Committee, thank you for the invitation to present my testimony today. I'm Kristen Hanson, and I work with the Patients' Rights Action Fund, a national, secular, nonpartisan organization. We defend the rights of patients facing the legalization of assisted suicide. I am an advocate for caregivers and patients. I am a mother, and I am a widow. I'm here today because I made a promise to my husband as he was nearing the end of his life in December 2017, just 4 months ago. My husband, J.J. Hanson, asked me to share the final part of his story and to keep fighting to protect terminal patients like him from the legalization of assisted suicide. It may seem surprising he would ask that of me when he knew I'd be overwhelmed with grief and trying to care for our 2 sons. But if you knew my husband, you'd understand why it meant so much to him. JJ rarely thought of himself, even in those final days. He dedicated his life to serving other people. He was a U.S. Marine Corps war veteran, a volunteer fireman, and he served New York State under Governor Spitzer and Patterson. Then, after JJ was diagnosed with terminal brain cancer in 2014, he joined the Patients' Rights Action Fund, dedicating his final days to fighting the legalization of assisted suicide. JJ saw firsthand how dangerous assisted suicide is to those who are most vulnerable. When a seizure sent him to the hospital in May 2014, he was told that he had glioblastoma multiforme, GBM, the deadliest form of brain cancer. The neurosurgeon said it was inoperable and that he likely only had 4 months to live. 3 different doctors told us there was nothing we could do. We were given no hope. We were told to go home and enjoy the little time he had left. At the time, we had a 1-year-old son. In an instant, we went from living the American dream to living a nightmare. Thankfully, we didn't listen to those doctors. We didn't accept their prognosis, and JJ had some great success with standard and experimental treatment. Not everyone has the kind of support that JJ did, from family, from friends, and the very best doctors. He outlived his grim prognosis by 3 years, 3 months, and 18 days. Every day is a gift. That was his motto. And it truly was, each day, a gift. During those 3 years, our son created priceless memories with JJ, and we welcomed a second son into the world. We would have missed out on so much if JJ had been offered and had accepted the option of assisted suicide. The bill before you today relies on a doctor's prognosis of 6 months or less to live. But even the most experienced doctors are often wrong. How can we let our life and death decisions rest on these prognoses? Our family's story illustrates how tragic that could turn out to be. If this legislation was legal at the time JJ was diagnosed, he could have requested the medication and had it on his nightstand. He would have had the lethal pills with him as he questioned if life was worth living. Am I too much of a burden to my family? Is this worth it? Would it be easier for everyone if I just ended my life? None of us knew it at the time, but he thought about it. He considered it. Thankfully, JJ didn't end his life, but if he had the pills with him in those darkest days, he might have taken them. And you can't undo that. You can't unmake that decision. There is no going back. JJ later told me with tears in his eyes, "Chris, I needed counseling. I needed help, not assisted suicide." These laws abandon vulnerable patients like JJ, who can experience periods of depression at any point following their diagnosis. In 2017 in Oregon, less than 3% of patients requesting assisted suicide were actually referred for psychological evaluation. How many of the 143 patients were depressed when they took the lethal pills that year? We'll never know. Once you receive the prescription, you're on your own. There are many fatal flaws with this legislation, but as a caregiver, my greatest fear is that when assisted suicide becomes a medical treatment, it injects governmental pressure and profit-driven insurance decisions into everyone's end-of-life choices. When faced with the choice, will insurance providers do the right thing or the cheap thing? I was constantly going to battle with our insurance company, and we had good insurance. I still had to spend countless hours on the phone trying to get them to cover procedures and treatments that were included in our plan. Thankfully, JJ had me there to defend his rights when he couldn't do it for himself. I was able to get him the treatment that he needed, but we were lucky. Dr. Brian Callister, a Nevada physician, had 2 patients who weren't so fortunate. His requests for life-saving curative treatments were denied. I'll say that again, life-saving curative treatments. Instead, both insurance companies offered to cover assisted suicide, even though Dr. Callister nor his patients ever requested it. How could insurance companies offer assisted suicide when it wasn't legal in Nevada? Unfortunately for those patients, they were from 2 states that have legalized assisted suicide, Oregon and California. If JJ were here today, he would tell you that assisted suicide is bad public policy. He'd say you cannot focus on the individual patient when you look at this legislation. You have to consider the many vulnerable people who will lose hope and be put at risk when suicide becomes a medical treatment. Legalizing assisted suicide will result in less choice for patients through external pressures, coercion, mistakes, and abuse. We should be helping our doctors and nurses with better training in palliative care and pain management, not assisted suicide. When JJ was dying, he wanted and needed better in-home hospice services, and he couldn't get it. There wasn't enough hospice staff to adequately serve our area. The choices other states provide weren't available to us here in New York. With all the wonderful programs New York provides, when it comes to hospice utilization, we're at the very bottom. We rank 48th out of 50 states, and we have the 2nd lowest number of providers per beneficiary. New York can provide better access to hospice and palliative care. Assisted suicide should not be the first thing we offer when it puts so many lives at risk. JJ believed that New York can do better. And I know you don't want to eliminate hope for countless New Yorkers. I am so grateful for this opportunity to speak for my husband and many New York families facing terminal illness. Thank you.